Reconstruction is something you hear a lot about in the media. More and more nowadays, people are even opting to get no reconstruction and deciding simply to either use a prosthesis or just go bare flat chested. There's an entire movement called flat topper pride that's all about not being defined by your breasts and not worrying about getting the reconstruction. Reconstruction is a painful process. I went through it. It took about 7 or 8 months to get to where I am now. Never dreamed that it would take all this pain and multiple surgeries to get a normal looking breast mound in a bra. So things that people need to consider are you're going to be dealing with surgical drains. And if you've never seen that before, there's a picture of it right there beside surgical drains. They look like little hand grenades with blood inside of them. It's pretty foul. But really, these drains just snake through your body and pull off that excess fluid, the serous fluid that's building up during the healing process. And you can have as many as 4 during this process, and they can last for a month. I had a drain in my armpit at one point for a month. It's pretty gross, and it makes it difficult to take a shower. Difficult to really dress normally because you have to have something that'll allow you to hang those drains from, or a pocket on the inside of your outfit so that they don't fall and hang down. They're actually stitched to a place in your body so that they would tug on that if that were the case. People have these unrealistic expectations about what is something going to look like? Is it going to be scar free? Is it going to look like my normal breast? The answer is no. You're going to have visible scarring. It's going to last for a while. Just in the past couple of years, my really, really red scars have started to fade to a medium pink. So we certainly will always retain the scars from the surgeries that we've had. Something people don't really understand is that when they have the breast tissue removed, they're also taking nerve tissue with it. So you're not going to be able to feel your breasts in most cases. You're gonna not be able to keep those breasts warm either. If you're dealing with a mastectomy, your breasts are going to be a couple of degrees cooler than the rest of your body, which is a little odd to get used to. And it'll feel really strange in clothing as well as you get used to this new body. But do expect a loss of sensation. That's something that nearly everybody experiences as they go through mastectomy. Realistic expectations is really important. People sometimes go in and say, "This is my free boob job. This is what I've set out to do," and they'll be really disappointed when their breast doesn't look perfect as they expected it to. You're removing a lot of tissue. You're removing a lot of skin. So in some cases, you have kind of a football-shaped breast that is left after the skin-sparing mastectomy. It's not going to be the typical breast shape. You're not going to have the projection that most people with a normal breast possess with a reconstructed breast. The goal is to get it to look symmetrical and normal in a bra, not naked in a bra. So that's hard for a lot of people to accept, and it certainly was for me early on.